Hello, Dr. James Bogash, publisher of Modern Health Myths, and today we're going to talk about a rather heated topic as it relates to COVID-19, and that has to do with asymptomatic spread. So basically, is this real, or is this more of the mythical unicorn that everybody thinks might exist, but we're never going to actually find? So as is always, when I present a more complicated topic like this with some data I've coupled with this with the PowerPoint, and I will, of course, provide the references that I talk about in the comment section at the end of the video. So a couple things to cover is when it comes to asymptomatic spread, and that's spread by somebody who has no idea that they have COVID, but could be breathing on somebody else and pass that virus on to somebody like my grandmother, and we could kill them inadvertently and without our knowledge of being sick. This terrifies people. The idea that everybody could be walking around as a potential leper, if you will, shedding, kind of like typhoid Mary, shedding this virus and infecting and making everybody on the planet sick and ill and dying. So this concept of asymptomatic spread is really at the heart of it all. All of the fear, the idea of wearing masks, the idea that I'm doing this to protect you because I don't know if I have the virus, and if I do, I could be spreading it to you. So how real is that thought process? So all of this started with the idea of contact tracing of patient 0 in Germany. And what was originally listed as an asymptomatic patient, this is where everything started. It turns out nobody actually asked if she had symptoms. Well, it turns out that she did, and she was using Tylenol to suppress a fever. So the whole concept and start with asymptomatic spread started with somebody who wasn't asymptomatic. They actually had symptoms. So that was kind of, it started the wave, and by then the cat was out of the bag before people realized that it wasn't really an asymptomatic spread, it was a symptomatic spread. But she had just kept her symptoms under control with Tylenol or whatever, or acetaminophen, whatever she had taken. A couple things we need to go over is it's very important not to confuse mechanistic studies with real-world studies. Mechanistic studies, masks are a perfect example. We've all seen this idea of wearing a mask and how you look at the videos and you see that it actually blocks the droplets. And this is what everybody hangs their hats on and says, see, we need to wear masks because this stops the spread. Those are mechanistic studies. And it's gotten us into a lot of trouble because then when we look at real life data, the real life data doesn't support it, because we also have to deal with infectivity. So just because we may shed a virus, or just because a droplet may come out when we talk, doesn't mean that that's going to infect somebody else. It's a huge gap, and it's a gap that the general public has a tendency to make when they see these mechanistic studies or these videos of droplets spreading with people talking. But do not mistake a mechanistic study from a real-life study. Obviously, the real-life study is more boots on the ground, and we're actually seeing how much the virus can infect somebody from an asymptomatic person. And I already mentioned it, but just because somebody, so there's the other thing we see from mechanistic studies is that, oh, well, asymptomatic people can shed just as much virus as everybody else, but then that's a mechanistic study. It doesn't mean that that can actually cause an infection or will cause an infection of somebody else. So do not mistake those types of studies for real-world studies. So if we get into real-world studies, there's a couple of them that came out of China, because we've had a lot of time to look at the data and tease it apart. The first one was a 22-year-old female who was in the hospital she had congestive heart failure, so she was in for other things. And as she was getting ready to leave, they just had ran some tests, and it turns out that she was positive for COVID. Truly asymptomatic, no respiratory, no anything. But they still quarantined her, and this allowed them to look at how many people she was exposed to that developed COVID. There were 455 contacts between coworkers, between workers at the hospital, between family members and other patients in the hospital. So 455 people she was exposed to, clearly lots of room for other people to get exposed. Now, we do have to say that this was in the hospital, so personal protective equipment and masks and goggles and everything were worn. However, this was early in the setting of the pandemic in China, in which case not all of those procedures were followed. So in general, this was a protected environment, but not as protected as we later became. And keep in mind that even with PPE, the risk of exposure doesn't go to zero. We see studies on influenza that PPE cuts exposure, but doesn't eliminate exposure. So keep that in mind. So out of 100 or 455 exposed contacts, 0 cases. Yes, 0 cases out of everybody that this particular person was exposed to. Move on to another one. This was a study looking at researchers looking at Italy, the numbers in Italy at the height of the pandemic in that country, and they evaluated the risk of an asymptomatic person. They estimated about 2 out of 100 people would have been asymptomatic at this time, and those people had essentially about a 1 to 100 likelihood of transmitting the virus to somebody else. So these were in situations in open air, so these weren't enclosed spaces. Masks were assumed, and no touching and social distancing. So everything we should be doing. And they found that the risk of infecting someone else was about 2 out of 10,000. So the idea that you could walk by somebody in the park and infect them is, like, again, you look at more likely to be struck by lightning. Actually, probably 2 out of 10,000 is far more likely than getting struck by lightning, but still a really low number considering how society views asymptomatic spread. Another study out of Australia. In these Australian researchers looked at multiple studies at how many cases were spread by asymptomatic carriers. The number wasn't 0, but it was close. They found out of 191 cases of asymptomatic exposure, only 1,091 contacts. There were only 16 cases that were transmitted, or about 1.4%. So really small percentages of an asymptomatic person actually spreading the virus to somebody. Another group out of China, they found almost 5,000 close contacts of cases. And when they looked at the numbers of spread, they found that for asymptomatic it was 0.33%, so less than 1%, 3.3 for mild, and 6.2 for severe and critical cases. So obviously the more symptomatic somebody was, the more likely they were to transmit that to somebody. Somebody who was asymptomatic was a very low percentage of likelihood of transmitting. So what does this mean? The bottom line is we need to not always rely on mechanistic studies. Just because somebody is shedding the virus does not mean that they can infect another person. Certainly the risk is there, but it is not the end-all be-all for transmission. And then when we compare that to real-life situations, in real-life situations we don't see a lot of asymptomatic spread. There is some, but the numbers are very small. And keep in mind, when we say asymptomatic, that means no symptoms. This isn't, oh, I haven't been feeling good and I took some Tylenol, I've had a little bit of a cough, but it's not anything. It's asymptomatic, as I would be right now, no symptoms, no anything. I feel perfectly fine, nothing to think I'm under the weather or not even feeling up to 100%. Every study done on transmission supports the idea that household transmission is still number one for exposure. This isn't happening out in the community. Those numbers are very small. Most of the exposure and spread is coming in the household. Now, granted, we get groups of people together and that can happen, but the bulk of the transmission is occurring in households. And even then, it's anywhere from 10 to 20% of people in the household will get infected when somebody in the household is infected. And so basically, like, just stop with the "I'm wearing this mask to protect you" scenario, because the data on asymptomatic transmission just doesn't support this idea that I should be shamed into wearing masks, or I should shame somebody else into wearing a mask to protect me. It's my job to protect my health, not anybody else's. And that's something that we've completely lost sight of. I've spent 25 years, 25, 30 years taking care of myself so that I can fight off whatever. It's not your responsibility. It's not the person next to me. It's not anybody's responsibility except mine to stay healthy. So, as always, welcome comments, and I will post the studies we're talking about in the comment section. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.